My name is Dr. Demetri Arnaoutakis. People just call me Dr. Demetri since my last name is so long. I'm a board-certified surgeon with a specialty in facial plastic and reconstructive surgery. So Restylane is a hyaluronic acid filler. There's a variety of them from Juvederm to Belotero to even a family within Restylane. It's best to be used for fine lines and any area that you're wanting to augment and add volume to. I prefer to use Restylane for the tear troughs or under eye area. When we describe fillers, we always refer to their G prime, which means the elasticity of the filler. And you can think of that as comparing something from Jell-O to pudding. So if I'm putting something in the under eyes, I want it to stay there. I don't want it to migrate or move elsewhere. So to me, the benefit of using Restylane is I know it's going to settle where I place it. A good candidate for under eye filler is someone who really just has hollowing underneath their eyes. We lose volume as we age. Sometimes it's just congenital and people have less volume there than others. So it's important to have a thorough evaluation of the under eyes, the skin, the texture of the skin there, the hollowness, as well as if there's any herniation of the fat pads there. That would be someone who would not be a good candidate for it, since you're just going to be making their problem worse potentially. The under eye area, the filler can last for a long time, anywhere from 9 months up to 15 months, sometimes longer I've seen. This area, there's not a whole lot of muscle movement, whereas if you're injecting someone's lips, it could be less time, 6 months even. So I think on average 9 months to a year for the under eye area. The procedure is actually a lot less painful than people expect. I like to do some lidocaine or numbing shots prior to using the filler. I think that helps calm the patient a little bit more and alleviates them. On top of that, the filler has lidocaine embedded in the product, so the procedure gets less painful as we go on. So whenever we perform a procedure or an injection, of course there's always risks. The most common side effects or risks we see with injecting filler afterwards is some swelling at the injection site. Of course, we're using needles or cannulas, so you can always expect that. Bruising is possible, but it usually only lingers for a day or two. One of the benefits of using a hyaluronic acid filler is that they are reversible using something called hyaluronidase. It's rare to have to reverse something done in the under eye if it's injected in the proper plane and with a good injection like Restylane, a good filler like Restylane. But that is a benefit for patients to know that in case something happens, that it can be reversed. Well, it depends on the area and, of course, what the patient wants. So if someone's asking for fuller lips, then they may need it touched up a little bit more frequently than someone who's just getting their under eyes done, or even if I'm doing an injection rhinoplasty, or it's referred to as a non-surgical nose job. Those fillers can last for a long time and there's not a whole lot of movement there, so they can do it at least once a year or every couple of years even.